So good morning, everybody. Thank you so much for joining us today for our full LHIC meeting. I know that the demand on everyone's time and energy right now is extraordinarily high. So I know that there will be several people kind of popping in and out of the meeting. And we recognize that we also may have cats and dogs and children and other things going on behind us in our meetings. But I did want to just say thank you so much for everybody for joining us this morning. We actually have a very full agenda. So we're not going to spend a whole lot of time going through some of our more formal pieces because I know that everyone has had the opportunity to review the minutes that were sent out, but it will go ahead and put in the chat the link to the past minutes as well so that folks can do that. I did want to just take a quick second. I know that we'll have, as I mentioned, some folks hopping in and out, and not to put anybody on the spot this morning, but I know that Dr. Elizabeth Crum with Howard County General Hospital, who co-chairs our coalition, is on the line with us this morning. And so, Elizabeth, I just wanted to ask if you had any quick statements you'd like to say before we kick off this morning.
Thanks, Kelly. I know we have a full agenda, so I won't say much, but just wanted to echo the welcome and appreciate your commitment this morning to joining and to being a part of this. I know that everybody is busy and everybody's exhausted, so it really means a lot that you're here and with us this morning, so thank you.
Thank you, Elizabeth. Like I said, I know that folks are coming in and out this morning, so we will go ahead and move swiftly. I just wanted a few pieces of housekeeping information that everyone is muted currently. I know that there are going to be questions. In a short time, we'll have some question and answer opportunities. Please feel free to message in the chat box, and you should be able to message not only myself directly, but you should be able to message our panelists as well as the entire group. So if you'll notice, there's a toggle screen and you can sort of select who that message is going to. So I just want to make sure everybody is aware of that. We also want to make sure that you know this meeting is being recorded. So all of our presentations and the recording will be posted after this meeting. As I said, I know people may have to step in and out, so we want to make sure that you don't miss anything. So again, I know that we have several new folks on the call with us today, and I want to welcome you. It is always wonderful to have so many new members. We actually have just about 453 individuals that have become members of our coalition, and we represent over 130 organizations as well. So the depth and breadth of our participants is amazing, and we welcome you to certainly share coalition meetings and information with others that you think might be interested. And we look forward to a time when we can actually all be together physically so we can meet folks in person. But until then, we'll continue with our virtual greeting and welcome. As we mentioned, our schedule today is very jam-packed, and so we have a lot to cover. So we're going to actually kick off right away with a preview of the 2021 Maryland legislative session. Very thankful to have our colleagues from the Maryland Legal Resource Center with us today. We're going to move swiftly into that, and I know that Dr. Hoke will be able to answer some questions, but we may forego question and answer because we do need to make sure that we provide an opportunity while we have our medical director and deputy health officer with us for the COVID-19 response and updates. So we'll make sure that we move into that. And then we're going to hear today from Laura Torres, who's going to share with us some exciting updates around the GBRICS program. And I won't say much about that because obviously she will be discussing that here shortly with us. So we will hopefully at the end have some time for member announcements and resource sharing. I know that's one of the key things that folks really do have a lot going on in the community. And so I want to make sure everybody has an opportunity to share that. And then if, depending on we have time, we'll keep the line open for a short bit of networking and connection. So all of that being said, I'm going to go ahead and we're going to move quickly into our next presenter. And Kathy, I'm not sure if you see the share button. If you wanted to share your screen, I'm going to go ahead and make you the presenter if you'd like, or would you like me to drive slides for you?
No, I'm fine to do it. And I'm
Okay.
ready to press the button when you allow it.
Okay, so I have given you the privileges and we see your smiling face now. And I did want to just know if folks have questions, please feel free to put them in the chat box. Again, we may have to pause on the Q&A after this presentation just briefly so that we can hear from Dr. Minicherry and Antigone Vickery, our Deputy Health Officer, while they're able to join us. But we'll go ahead and get started. So thank you so much, Kathy, for being with us today. It's so great that every year you join us sort of for the what's going to happen and what did happen. And I'm sure there's a lot of very, I want to say strange, very different ways that things are happening this session. So I'm going to turn it over to you.
Absolutely. Thank you, Kelly. There are some doctors Hook, but that's my brother and his wife, my sister-in-law. I'm just Kathy. So
well, there you go.
Yeah, the JD does not grant us the doctor privilege, and I don't want to get into that whole debate about PhDs and doctors, so I don't have one anyway. I think anybody who earned a PhD should be called a doctor. In any case, so thanks for having me. As always, I'd rather see you all in person. I definitely miss that aspect of our lives, and so hopefully I'll get to see you guys in the summer at a meeting. But for now, I just want to give you a brief summary of what happened in 2020, a peek into what's going on already in 2021 on some health-related bills that I think are of interest to this group. So the first thing is, I heard Kelly repeatedly, we're not gonna have time for Q&A. That's always the case when I come talk to y'all. But the great thing is you can email me anytime. Number one, my email will be at the end. You can email this address that's on the screen now, or you can join our biweekly conference calls where we do updates on the public health legislation that's pending in the Maryland General Assembly. My law student, clinic students run those meetings, and they do a really nice job of both centering some particular bills of interest to folks on the phone as well as answering questions. So please feel free to join us. And you can also shoot me an email and I can send you a link to our chart where we track all of the legislation. It's live updated, it's continually updated with hearing dates and vote records and the like. So just shoot us an email and we'll get you that. So as Kelly indicated, lots of changes due to COVID. If you're not somebody who's routinely down in the General Assembly, it may not strike you as significant, but if you're somebody who's been down there to testify, everything has changed. So all hearings, whether the Senate or the House, are virtual with varying limits on the number of witnesses. The Senate is very limited on the number of witnesses that get to testify, whereas the House is a bit less restrictive. You have to sign up to testify and submit your testimony 2 days in advance. For Monday and Tuesday hearings, that means Thursday and Friday submission. So that's a big change for those of us used to walking in the day of the hearing to sign in and submit our testimony. There are very few, and I want to say really no, in-person meetings with legislators. That used to be our bread and butter of, particularly for folks, for example, meeting with your Howard County Coalition folks and letting them know what bills you're interested in or what issues you're interested in. And there really hasn't been the opportunity for that. And I think that's, a downside for sure to this virtual world. Hearings, voting sessions, and floor sessions, and some subcommittee sessions are all live streamed on Zoom or on YouTube. So you can pick the forum in which you want to participate. When you do testify, you testify through Zoom, and they send you a Zoom link as someone testifying, so you don't have to watch it through one of those links. The other big difference for this year for us was we're used to about 24 pre-filed bills or so, and there were 781 pre-filed bills, and hearings started instead of the third or fourth week of session, or typically they get rolling like the third week of session. They started the second day of session. So the hearing schedule has been rapid. We haven't taken a breath yet. And there also are limited sponsors on the bills, and so you don't see bills with 20 sponsors. Mostly it's one sponsor on each side. Now, the overall number of bills is actually down from years past because I think members were discouraged from overdoing it this year. So lots of was, on the front end with those pre-filed bills, and we're seeing a trickle in. The deadlines are coming up for bills to be filed. Tomorrow is the House deadline and Monday is the Senate deadline. So by next week, we should have a good idea of all of the bills that'll be heard this session. Just one quick note is normally we can't access written testimony except to go down to Annapolis and get copies of other people's testimony. But this year they have, for the 2020 bills that were heard last year, you can go to the bill page, and if you click on the button that says witness list, it will pull up the witness of everybody who testified, whether they were favorable or against, and a link to any written testimony that was filed. So that's brand new. For this year, when a bill is heard, if it gets out of committee, they will immediately post that witness testimony. And then at the end of session, they'll post it for all bills. If you want hearing testimony on a bill that's been heard, but didn't get out of committee yet, you can ask the committee to send it to you. We've done that on 3 bills already, and they sent it pretty quickly. So our access to both watching the hearings live or after the fact, but having that written testimony is incredibly helpful. So what happened in 2020? Probably the most significant one is an increase in the tobacco tax and the first-time tax on vape products. And so you can see here what those numbers are for the vape products, also called ESDs, electronic smoking devices. 12% of the taxable price on the products itself, the devices itself, and then 60% of the taxable price on the vaping liquid containers. Cigarettes will go up to $3.75 a pack. And again, you can see the others here. Importantly, here was also, as part of this legislation, that starting in fiscal year 2022, which actually begins in July, it requires the governor to include $18.25 million for our tobacco programs that the state health department runs, and obviously trickles down to our local health departments as well. The governor did veto this bill. The veto override will be heard in the House on Monday, in the Senate on Tuesday. I do believe the veto override will occur. There has been some debate over a digital advertising tax that was also included in this omnibus tax bill, but I think that they're going to override this bill and maybe repeal the digital advertising tax. That's just my guess, but I think we're looking good on the veto override. The flavored tobacco ban, despite the fact that the bill failed, I'm bringing it up here, it was a comprehensive bill that would have prohibited all flavored tobacco products, including vape products and including menthol cigarettes. However, it was significantly amended when it crossed over from the House to the Senate in ways that the advocacy community, American Cancer Society, Heart Association, Lung Association, our community coalitions were no longer in favor of the bill because it cut out, large swaths of the bill. And so the bill has gone, so the bill died. It did not get heard in the Senate. The bill has been reintroduced exactly as it was introduced last year. But again, our core group of advocacy organizations and individuals who work on this legislation deeply concerned about amendments to the bill that we've already seen trickling in. I've been asked to review some, and yes, those same concerns hold. So while the bill is in a great form, the amendments that are going to come in are likely going to strip it down to where it was last year and becoming less palatable from the public health community. Another bill that was in last year that I expected to be able to say was in again this year was the bill that would allow pharmacists to prescribe tobacco cessation medications. The goal of allowing a pharmacist to prescribe is in large measure so that health insurance, including Medicaid, would cover the products. And because if they're prescribed, even if over-the-counter products, then they can be covered either by your insurance copay or for Medicaid, not at all. The bill was watered down last year. They removed the ability for pharmacists to prescribe Wellbutrin and Chantix, some of the prescription required medications and eliminated some of the mandatory coverages. So it was a watered down version of the bill that passed the House and Senate and went over to the House. But they did not have a hearing on the House. We actually expected the bill to go in this year, but so far haven't seen it. So maybe it'll pop in the next 48 hours or so. So what is pending this year? Probably the biggest bill, and this is probably of highest interest to Howard County, a home rule county with otherwise plenary public health powers, both in the county council, the county executive, and for you all, your very dynamic Board of Health. And this is Senate Bill 410. The House bill just got introduced yesterday. I don't know that the number was even up yet, but I didn't pop it on my slide yet, but I'll get that to you if you're interested. This bill would reverse the impact of a 2013 Maryland Court of Appeals decision that found that state law preempted local jurisdictions from heavily regulating in the tobacco space, meaning Howard County could not do its own flavored tobacco regulation, something I know many folks in Howard County have asked about being able to do. It arises out of a case that involved a Prince George's County ordinance that imposed a minimum pack size on cigars, those cheap little flavored cigars that are very attractive to young people. Minimum packaging drives up prices, drives down youth access, but the court overturned that, saying the state preempted. So this bill would reverse that preemption and return the local power where it belongs to the local governments, where we know, tobacco control and public health innovation is much more likely to occur. That hearing on the Senate side will be on February 11th, and the Legal Resource Center will be there to support the bill. There's also a bill, Senate Bill 273, that would regulate ESDs, or electronic smoking devices, vape products. On its surface, the bill looks pretty good. There are some concerns about some of the technicalities, some problem with the language. We're a little concerned that just like the Altatis case preempted local regulation of tobacco products, the result of a bill like this will be preemption of local regulation of vape products. And so we'd like to get anti-preemption language in there. And there are some concerns, again, it would include vaping in where indoor smoking isn't permitted. It would prohibit indoor vaping, but some of the language is a little concerning about creating smoking or vaping lounges, which would not be palatable from a public health perspective. I know there's already a suite of amendments on this one also, so if it's something you're interested in, keep in touch with me, shoot me an email, and we'll let you know how things are unfolding with this particular bill. Now, beyond tobacco, a couple of issues when Kelly and I talked that we thought might be of interest to this group, an exploitation of seniors bills. We often see bills related to increasing penalties or the like for financial exploitation or physical or mental abuse of older people. This bill's interesting. It would create a civil action, so not a criminal case, but a civil action for financial exploitation of vulnerable adults. It's not just seniors, it does also apply to vulnerable adults with disabilities, substance use disorder. It uses habitual drunkenness. That's a term that's used in the code, unfortunately, but it really applies broadly to a swath of vulnerable adults. It's interesting because it doesn't require the state to take action through criminal law, but individuals themselves on behalf of the vulnerable adult, even after death, an estate or other family members can bring a cause of action against the individual who did the exploitation to recover those monies. There was a bill hearing yesterday on the bill. They definitely talked about amendments. There were some friendly legislators who wanted to offer amendments to, I think, make the bill even better related to punitive damages. And so we'll be keeping track of this. I will note that there was a bill passed last year that would have created at the Office of the Attorney General the Senior and Vulnerable Adult Asset Recovery Unit, which would have done some of this work for individuals trying to recover the assets that were exploited, monies essentially, or other, items that were taken from a vulnerable adult and return them back to the parties. So that's an indirect way of this civil action happening. And the governor did veto that bill. The Senate has already overridden the bill, and I believe the House will be taking that up next week as well. So fingers crossed for that one. I think that would be also an important protection for folks, so you didn't have to bring the litigation yourself. Food bills, when Kelly and I talked, she said, can you talk about any food security bills? And I said, no, because there aren't any, Kelly. And she thought that would be an important note to pass along to you all. Very disappointing in the era of COVID, when we know there are families that are housing insecure, food insecure, employment insecure, struggling with education, struggling with social context and the like. And so if all of the social determinants of health are at risk here, why is there not a plethora of bills on food security in the Maryland General Assembly? I can't answer that question. I'm as stymied as any of you might be. I did point out here, there is one, House Bill 101, which is helpful. It is something that I think a dozen or so other states have a provision like this, and it really allows for a deduction from your income for utilities that you're paying that is then increases your SNAP benefit. So it's for folks who are already on SNAP and a way to increase their SNAP benefit, but really nothing else of significance. There is a bill to create a food resiliency task force or work group. That is House Bill 831. We're following that one, but it doesn't do anything substantive. It just creates a work group to take care of a problem that we know exists. So I don't understand why we're not taking care of it instead of studying it some more. You can see, seriously, nothing else food security related. A couple of COVID bills I just wanted to run by you guys. There are several bills related to immunity protections. These are immunity protections for healthcare workers, but really beyond that, those who support healthcare workers, meaning administrative staff, support staff, and the like. We know around the country that healthcare systems are using sometimes volunteers, sometimes employees who they're hiring contractually to help, for example, monitor or help with the flow of traffic through a drive-up testing site or a vaccination site, folks who are doing data entry and the like. And so this bill not only would add additional immunity protections for healthcare workers, but also those who are supporting them. And there's actually a variety of bills doing this. And then there are some immunity bills for employers. Essentially saying that if an employer abides by essentially CDC and state level best practices, meeting all occupational and safety requirements, they cannot be held responsible if their employees contract COVID at work. So that's there to protect employers. There are some worker protection bills as well. I realize there's a typo here. It said it would add ASH standards. Maybe my autocorrect worked there and I didn't notice, but it should be OSH, Occupational Safety and Health Standards. So it would add that, again, businesses have to abide by certain standards designed to protect them in the workplace. And there is a specific bill that extends protection to migrant workers who we know often come, during certain seasons in our agricultural communities, as well as crab picking, which is a big, migrant worker job. And they are, living on top of each other in housing provided by the employer, not in what would be considered safe conditions. So there are several bills looking at ways to protect employees from exposure to transmission. And then lastly, the Governor's Relief Act. Again, there were dozens of others I could have listed here, but I thought these were the more significant ones. The Governor's Relief Act that would essentially provide, based on income, up to $750 to individuals and families in just a direct payment like the stimulus payments. There is significant additional funding for the unemployment program that we know has been tapped. So he has proposed to increase the funding there. And then there are a number of relief provisions designed for employers and small businesses. So providing tax breaks to employers, not requiring them to pay certain unemployment taxes. Not that folks wouldn't get their unemployment, but that the employer wouldn't have to pay in to certain unemployment funds, as well as some relief associated with when and whether and how much they would have to pay back from the Paycheck Protection Act or PPP loans that they would have received through the federal program. So I think I've kept us on time, and here is all of my contact information. If you have any questions about this presentation or otherwise, please don't hesitate to give me a call or shoot me an email. My students and my staff and I are happy to answer any of your questions.
Kathy, thank you so much. I do want to invite folks, if you have any questions, you can go ahead and put them in the chat. As I said, we will definitely be following up and, making sure that those questions are shared.
So there's a question I see, do you know when the extended Medicaid dental benefits for pregnant women will be signed? And I don't know, but I'll follow up with you. I see it's Sue, and I'm not going to even try to say your name and embarrass myself, Sue. But if you put your email address in there, I will email you. If you pop that in the chat.
All right, so thank you very much. And we're going to go ahead and, as I said, we're going to launch pretty quickly. Our Deputy Health Officer, Antigone Vickery, has joined us, and I know that our medical director, Dr. Elizabeth Minisheri, will also be joining us here shortly. But I'm going to go ahead and turn this over to Antigone, and she's going to provide for us a COVID update.
Thank you, Kelly. Good morning, everyone. Pleasure to be here this morning. Today, I'm going to give an update. Dr. Minisheri and I will give an update on where we are with COVID. It's quite timely because it's quite hard to believe COVID has been in the U.S. for a year now. And next month will be our anniversary where COVID has first arrived in Maryland. Hard to believe it has been a full year. COVID has impacted us in so many ways, and these numbers just tell part of the story, as I'm sure you all know. Over 14,600 confirmed cases. We have over 7,900 active cases right now, and sadly, we've lost over 200 neighbors to this virus. If there is a glimmer of hope, besides the arrival of vaccine, is that currently we are seeing a downward trend in our metrics, including our positivity rate, which right now is at 5.6, and our 7-day average, which is trending downward at 22.8. So, cautiously optimistic, but these trends are definitely moving in the direction that we like, which is down. During this year, while we have all been anxiously waiting for this vaccine, we've been doing all that we can to try and manage this virus that has consumed our community in so many ways. And we've done so through messaging of hand washing and social distancing. We've been conducting contact investigations, managing outbreaks, distributing PPE to our healthcare providers around the community, and all along working on a mass vaccination plan, because ultimately we knew at some point in time, didn't know quite when, but at some point vaccine would arrive. So throughout the year, we've been refining existing plans. Many people don't know that local health departments are required to have medical countermeasure distribution plans. That includes plans for distributing medications as well as administering vaccines. So we have these plans already in place, and we exercise and test these plans regularly over the years using our flu clinics. So solid plans in place. And of course, though, we need to drill these plans down to be particularly responsive to COVID, which adds an extra challenge because of the nature of COVID and the need for social distancing and so forth. But very happy to say that our vaccine has arrived in Maryland It came in Maryland about 6 weeks ago, the week of the 24th of December. And as soon as we received the vaccine, a few days later, we implemented our very first clinic, which was the 29th of December, which is the starting point of our implementing our mass vaccination plan. And I will take a moment to say that the implementation of these plans at the scale in which we're implementing cannot be done without the partnership and collaboration, extraordinary partnership and collaboration of so many partners across the community, including our police partners, partners at fire and rescue, community resources and services, parks and recreation, our hospital partners, our academic partners, and so many community partners that we have. This cannot be done without everybody involved. And I'll just take a moment now to thank everybody who's been involved to this point in time, and to those who will be reaching out in the future to partner later on. If you can advance, please. Our vaccination plan has many components to it. It speaks to the phased approach to vaccination, mass vaccination, which is required when vaccine is in short supply. The plan speaks to different models and sites that we'll use. We will be using the community college as well as some high schools and our own health department site at Ascend One. It speaks to capacity and expansion, staffing and the workforce use, communication and outreach, key policies and protocols that are outward facing, and various logistical things that we need to be mindful of, including allotments, ordering, inventory management, handling logistics, safety and security, data and quality improvement. Lots of things to keep on top of when you implement a plan like this. So when vaccine is in short supply, we have to utilize a prioritization scheme. And what you see in front of you is the state's prioritization scheme. It is statewide. There is local flexibility. That is needed because we are such a diverse state that has very large counties and very small counties. And for that reason alone, county executives across the state petitioned to allow local jurisdictions some flexibility to advance through the various phases. The smaller counties to our west and our east are able to proceed through these vaccination phases pretty quickly, or certainly more quickly than the larger counties surrounding the Baltimore region and the DC metro region. And for those reasons, if you could go back for a second. And for those reasons, thank you. For those reasons, Howard County is still in 1B. If you can advance, thanks. So just to drill this down a little bit for perspective. So Howard County population over the age of 16 is 256,415. And we're looking at this right now, our population numbers over 16, because the currently approved vaccine is for 16 and older. The Pfizer vaccine is only permitted for individuals 16 and older, and the Moderna vaccine 18 and older. Of that group, 82,000 people are currently eligible in phases 1A and 1B to receive the vaccine. So far, we've administered a little over 15,000 doses, first doses to individuals. We started doing second doses last week, but this number reflects just first doses. We do have the capacity to do 20,000 doses of vaccine a week. That said, we're only receiving 2,000 to 3,000 doses a week, and supply is limited. So as you can imagine, the demand for vaccine, as we all know, is very, very, very high. And the supply right now is pretty low. To give you further perspective on this, that the state receives about 72,000 to 76,000 doses of vaccine a week. That works out to be about 10,000 doses a day. So, it is limited, and we've been told the vaccine supply is pretty much stagnant, that the general supply is not anticipated to increase until likely a third vaccine comes on the market. So right now we're spending much of our time just doing our best to manage such a significant community demand for the vaccine when there is such short supply. But really what everyone wants to know is, how can I find a vaccine? And that's what I want to spend time talking about. So I'll lump these into, excuse me, I'll lump these into two groups. One, Howard County Health Department is one of the main distributors from the beginning of COVID vaccine. We currently operate 2 sites that are live right now. One is at our, excuse me, our
I'm gonna jump in there. Antigone,
Sorry,
are you
I'm
back?
back.
Okay.
Kelly has been forewarned. I'm struggling with a respiratory issue, so my ability to talk long, uninterrupted is a little challenging. So 2 sites we're managing at the health department, or by the health department. We have our site at Ascend 1 in Columbia, which is our main health department headquarters. And last week we expanded to the community college. These are just pictures so people can see exactly where. Most people are familiar with going to the health department, entering to the front of the building and coming to our conference rooms for LHIC meetings and other events. These clinics are being operated in the back corner of the building, utilizing the multiple conference room spaces that are part of the Howard County Public Schools System Conference Center. Right now, we have completed first doses at the community college, and we are doing second doses there and specialized clinics that are for smaller populations. We've shifted over to using the community college because it can much more easily accommodate the larger groups of people that we need to accommodate. For our clinics, how does the public find out about our clinics? So previous to this system, we had no mechanism to reach out to different groups who are in the priority population. So we created these, what we're calling pre-registration forms. They're not really registration per se, but a mechanism for us to collect information so we can communicate to you. You can go to the website, and this screenshot here is just an example of these surveys or these information collection forms on our website. People can go online, they can put their information, and when we have vaccine available for the different priority groups, we push information out by email. That is how we've been doing things for the last couple weeks. Excuse me. We've shifted and augmented our communication processes by adding a telephonic component that had come online late last week. So we will start pushing out messages using a system that pushes information out via email, phone, including cell and landline, and text messages. But we still need to have, go back, please. We still need people to put information into those surveys so we have your information. We recognize that there are some definitely technology challenges with this, and individuals can call our phone bank. Excuse me. Individuals can call our phone bank, and there are representatives who can help fill out the forms for people. Next, please. The second way to receive vaccine is through other providers. So as I mentioned, vaccine supply is generally stagnant. We don't believe that's going to change anytime soon. And in fact, our supply might be less because the state is in an effort to try and increase the number of providers in the community who can distribute the vaccine. If you're only dealing with a set amount, ours may be decreased. So additional providers are coming online, and I want to talk about this for a moment. So starting tomorrow, assuming things don't change, the state will begin opening statewide sites. So the first one to come online will be tomorrow at the convention center. The plan, and people may know, the convention center has been a well-used site for COVID testing. Starting tomorrow, the operations will change a little bit, where testing will be the focus of the site in the morning, and testing will continue there, but focus solely in the afternoon. We believe, and we've been asked this question, yes, appointments will be needed, and yes, they would likely be adherent to the phases. Additionally, there's sites going up at Six Flags, and mid-February, an additional site will open up in Baltimore. They say February 17th, but I'm just saying mid-February, and that will be at M&T Bank Stadium. In addition to the statewide sites, where they are, I'm assuming, going to be open up to 1B and 1C, but that hasn't been specified yet. In addition to the statewide sites and the health department, retail pharmacies are coming online. Some hospitals are opening up to community vaccinations. And in the future, large group practices will be able to distribute vaccine. Large group medical practices can register online to be a vaccine provider. As far as we know, I don't believe any of the major practices has received vaccine just yet, simply again, because of supply. Speaking to the retail pharmacies and the grocery stores, not every site will have vaccine. Similar to how they manage testing, not all Rite Aids or Walgreens or CVS's did testing, only selected sites did. And currently, right now, none in Howard County are live. We made some phone calls this week to drill this down and find out more. And the people that we spoke with either didn't know when they were going to receive it, and one stated that they expect to receive it in March. So right now, the retail pharmacies in our county do not have the vaccine. We are monitoring it, and as we know, when our pharmacies in our county have vaccines, as well as the grocery stores, we will begin compiling a list on our website. But the state does have a vaccine locator, and that link is right there. And I do want to be mindful of time, because Dr. Menacheri has a hard stop at 9:30. So I can stay a little longer to answer the non-medical questions at the end with regard to vaccination. But so I'm sure people have some questions. That was a lot of information. But if Dr. Menacheri could proceed, then we can take vaccination questions at the end. I just want to make sure that she has the opportunity to speak.
And I would definitely invite folks, if you have questions, please go ahead and put them in the chat, and then that way Dr. Menacheri may be able to answer them as they come in.
Great, thank you. Can everyone hear me?
We can hear you.
Okay, so how effective are these vaccines? So many have heard things on the news. There are currently 2 FDA emergency use authorizations that have been approved. There's others that are in line in the approval process, but the Pfizer biotech is commonly known that you get 2 doses. They are 21 days apart. You can be 16 years or older. The Moderna is also 2 doses that are 28 days apart, and you must be 18 years or older. Pfizer is rated to be what they consider 95% effective, meaning their rate at preventing moderate to severe COVID disease, and about a 90+% at preventing hospitalizations and death. Moderna likewise is around 94-95%, but a little higher percentage of effectiveness at preventing severe disease. As I said, there is news of Johnson & Johnson, which is a 1-dose vaccine, about 66% effective. and then the AstraZeneca, which is ranging between 52 and 76 percentage difference. And there's more to come on that. Next slide. So what's the key facts you need to know about vaccination is that, as we said, they're effective at preventing the infection anywhere from 56% all the way up to 95%. And the current approved vaccines are 94 and 95% effective. People who have gotten sick with COVID, they develop their own antibodies, and some studies are saying that they have antibodies for up to 6 months after their infection, actually 3 months in 99% of the people, and this is a study called Siren that looked at that, and then there's a UK study by UK Biobank that found that antibody production is definitely evident in humans who have had the COVID infection, but they don't know how long, and so it is beneficial to get vaccinated, even if you've had the natural infection, to boost your immune response and the longevity of the antibodies that you produce. The COVID vaccines, currently, they're mRNA vaccines, which do not contain any viral particles at all. It's just basically a code. I tell people it gives you the recipe for your body to make the antibodies. And so there is absolutely no virus in these vaccines. So you cannot get COVID or SARS-CoV-2 infection from these vaccines. And lastly, because these are not containing any viral particles in the vaccine, the mRNA vaccines do not cause any kind of conflict with testing. So viral tests do not get changed to becoming positive if you get the COVID vaccine. I did want to say one clarifying point, just to clarify what Antigone said. At the Baltimore Convention Center, not only will they be doing testing, they will also start vaccination. And I think I just wanted to clarify that it would probably be vaccination in the morning and testing in the afternoon.
Thank you, Dr. Minicheri. I do invite folks to put any questions that you have in the chat, but I'm going to just start with one question that I know has been in the news and certainly something that's come up in conversation. Can you talk anything about what we may know at this point around some of the variants in terms of the rate at which they may spread versus what we've been dealing with?
Sure. So there are variants, and basically the variants contain changes in the region of the spike protein, which is where our natural antibodies and all the vaccines are targeted for. And some of the variants contain something called an escape mutation, which is basically the changes that elude our immune system in fighting the virus, either through natural immunity with our antibodies, vaccine antibodies that we produce, or the monoclonal therapies that we receive. And so right now, the known variants throughout the world are threefold. One is a UK variant, which they call the 117. Then there is a Brazilian variant, which is P1. And then there is a South African variant, which is 1351. So all of these have different names. Our concern is that these variants, to some degree, are covered by some of the vaccines to some extent, but not fully. The mRNA vaccines seem to have some coverage of the variants. The Johnson & Johnson vaccine that's in line for FDA approval has less effectiveness against the South African variant. And because of that, manufacturers and companies and researchers are looking at if another vaccine needs to be created that is specific for these mutations that these viruses are having. The biggest problem with the mutations is that if they have mutations in the spike protein that elude our current antibodies that we produce, then they can become more disease-provoking or more concerning if we are not vaccinated. And so the key is to prevent infection at all costs, as normally we would. And face masks, social distancing, and hand washing is still very, very effective at preventing all disease of SARS-CoV-2. And so that is still the recommendation, whether you've gotten vaccinated or not, to prevent the spread of these variants. Some of the variants are easier to spread than others. And so it is very important that we start to be very adherent to face masks, social distancing, and hand washing even more than before. And the other part is vaccination or natural immunity through people who have gotten the infection, or induced immunity through vaccine. to start to have some antibodies on board that can help fight some of the infections and prevent the transmission. The virus can only mutate if it is replicating, meaning it is being transmitted. So we really do need to prevent people from getting infected. And first line is anything that everyone can do: face mask, social distancing, hand washing. The second line is either antibodies through natural infection or through vaccination. And then third, the concern with these mutations are that we could have a resurgence of disease surge because of the variants being easier to transmit and more mutations happening.
Thank you. We did have a question that came in the chat about, since we know that antibodies are short-term, i.e. 3 months, have there been any known cases of someone who's had 2 cases of COVID back to back? And I guess that leads into a follow-up question, which is there the possibility of booster shots, or, you know, not knowing necessarily how long the vaccine will last? So 2 questions.
Yeah, so there are cases of what we call reinfection, and definitely with these variants, there is a chance that you can get infected with the variants. And so that is something that they're researching. We don't know how long out someone could be reinfected. The CDC currently says that within 90 days, there's a very slim chance that you can get infected again if you've had the SARS-CoV normal variant or the original virus. However, with these new variants, because there are differences in the mutations on the spike protein, there is definitely a chance that these variants can cause a second infection. And then your second part of the question, Kelly, remind me.
What do we know about any type of booster process on the horizon for vaccine?
So again, it's early in research, and I know Moderna is working on another booster vaccine. They haven't released whether or not it'll be necessary or not, but you know, I think that the likelihood might be good that there is going to be another vaccine directed towards these variants, and we'll just have to wait and see.
Wonderful. Thank you very much. I know, Dr. Minateri, you have another meeting, COVID, of course. I think that's probably all your time at the moment. So I want to thank you very much for, you know, being with us for a few questions. And if additional questions come in from the chat, we'll certainly get the answers for folks and share them. Antigone, I'm going to launch into the second part, but I didn't know if you had anything you wanted to say as well.
No, if I know I gave a lot of information. If I mean, you're almost done with the slides, and I can hang on for a little bit, so I can try and, if there's questions, I can wait.
Sure. So, you know, a couple of things just in follow-up to what Antigone and Elizabeth both shared with us. A lot of people do ask, what can they do now? And I think, you know, it's clear that we do have limitations in terms of, you know, where we are in regard to vaccine supply. But there are actual things people want to take action now on what they can do. And so some of the important things are, you know, staying connected. There's a variety of connection resources in our community. So making sure that you're connected through the Howard County Health Department's weekly newsletter, the Ball Bulletin. Howard County General Hospital has an eWellness Matters regular communication through the HCLHIC Digest, the website. So we've definitely provided some information there. As was mentioned before, making sure you're registering for the communication alerts. And I think one of the asks for the group would be, as you go forward and educate your stakeholders and your folks that you work with, that you communicate that these are really communication alert surveys, that people are not receiving their appointment by completing that communication survey, but it's really a main way that we can get the word out about clinics when they become available and other information as needed. We are also asking people to think about organizing and supporting both their personal and their organized buddy systems. There are, as we mentioned, some technological considerations, and there are a number of people in our community that may not feel connected, may not know where to connect or how to connect. And so we ask each of you to think about your own personal and organizational networks and how you might be able to help facilitate connection for folks. I've heard some great stories about, people adopting, older members of their faith community or neighbors across the street or different community organizations that are chiming in and helping out with transportation and other things. So, really thinking about that. And that leads into opening the doors, not only to the access to the vaccine, but having conversations to help increase confidence in the vaccine. And we'll talk more about that in a moment. But also, I think, in light of, this month, especially, paying attention to fraud and awareness. I know many of our partners through DCRS are really focusing on this month and awareness around that. I think educating other people to avoid scams is also very important, because we know that as this progresses, there can be people that will take opportunistic approaches, and we don't want people feeling like I can go buy vaccine online, or I can, if I pay $20, I'll get my shot now, or I can get bumped up in line. We recognize that many people are anxious and want to do whatever they can. I mean, I've heard so many references to, small networks trying to be the vaccine finders and all kinds of things, but we want people to be cautious as well. So having those conversations. And then a couple other things. Dr. Minicheri mentioned a lot of the personal protective things that we can do, the measures that we can take. So continuing those things. Howard County government has launched the Stay COVID Safe campaign, and there are resources and materials that are available for everyone to participate in. So if you're interested in more about that, I'm happy to connect you. You can just put that in the chat. We want you to get your vaccine when it becomes available, and encourage other people to be vaccinated. I think hearing personal testimony from folks, I know, even just in my own network, sharing, oh, how did I feel after the second dose? How did I feel after the first dose? Has allowed people to ask questions and to talk. And no, it's not one size fits all, but I think it does help reassure people. And then volunteering. There is truly a space and a need for both clinical and non-clinical volunteers. And Howard County is very fortunate that we have a very active medical reserve corps. But if you are somebody who can give some of your time and energy to support this, as Antigone mentioned, our capacity to do 20,000 vaccines for our community a week is because we have wonderful community partners and because we have a very robust medical reserve corps. So if you have time and energy, we can definitely find work for you to do. And please don't feel that if you're not, able to, as the governor says, put vaccine in arms. We need help with everything from line control to assisting older residents who, may be confused on how to complete, their follow-up appointment registration, to helping to market and share information and as ambassadors. So by all means, please let us know, and we can find places and spaces for everyone. The last thing I want to mention, and then I will, we're going to share a little bit about some of the work we've been doing around vaccine confidence, is that there will be a vaccine telephone town hall on Monday evening, and you can pre-register and pre-submit questions for this. We have been very fortunate in Howard County, and I say that truly believing that it is a wonderful opportunity for us to talk to the leaders in our community. So Dr. Margarano with the school system, Dr. Ahmed with Howard County General Hospital, Chief HCLHIC, Dr. Rossman, Dr. Clarence Lamb, who's one of our state senators, and Jacqueline Scott from DCRS will all be available to answer questions and address concerns from our community. So I encourage everybody to take advantage of that opportunity for sure. So as we kind of move into additional discussion, I just want to encourage everybody again, please feel free to submit questions in the chat box. And as a reminder, we recognize that everyone is very much balancing time today. So, folks that do need to pop in and out, please feel free to do that. We'll still be here. We understand how, working in this virtual setting and can require many things. I did see a question in the chat about making sure that we can share the information about the town hall link. And so I'm going to ask my colleague to put that in there. I think she may have done that. But yes, we definitely encourage folks to register for that. So I mentioned talking about, that confidence element, and I think this is probably somewhat biased towards folks who are Apple phone users or Apple product users. But when you talk about the iPhone, there are the people who hear that the iPhone 12 is coming out, and their response is, I am going to sign up, I'm going to pre-buy it, I'm going to camp outside of the Apple store before it comes, I'm going to do what I can to be one of the first people to get it. And I say that with, somewhat humor in mind, in that there are many folks that we're seeing right now who are ready, and they're waiting for a variety of reasons: fear, concern, need. The Apple reference, not to make light of what many folks are looking at. But there's another category for the Apple folks, and those of you that are users can probably relate to this, that things come out, time changes. So there's always these new Apple updates. There are some people who are early adopters of the updates and they'll do them quickly. And then there are others who are a little more tepid. I'm going to wait and see what happens. So we have many people in regard to vaccine uptake that really have questions. They're not against the vaccine per se, but they may have some hesitancy for a variety of reasons. And we know that those reasons can be stemming from experience, maybe negative experience that they've had with, I didn't feel good after my flu shot, all the way to the historical experiences of racism and inequity in how vaccines had been tested or how they had been used. So, again, there's that I'm going to wait and see perspective. And then there are definitely those folks, I jokingly and lovingly I call my dad the flip phone, who is just not ever, he is not ready to convert to anything. He's not even considering it. And so I really think that, we as a community have to be focused on, although we're seeing right now a lot in regard to I'm camping out for it. We're seeing that on the national news, and we know that we have limited supply. But before we know it, I really truly believe we're gonna blink and we're gonna realize that we have a number of people who have been hesitant for a variety of reasons. And so we started thinking about this very early on in this process, and talking about how can we intentionally work to facilitate trust and relationship building around this, so that we can have that connection to provide education. And so as testing, which was also new, now it seems like seasoned old program, right? We really started doing some pilot work through both the health department and partners with other organizations. And so we did early in the summer, June and July, we did some pilot testing where we tried sort of pop-up testing sites, both at local residential areas, in partnership with Fern, through clinics that they were doing, and testing clinics that they were doing. And then also in some work that we're going to hear about from Howard County General Hospital. Just a real quick note to highlight some of the work that we did with Fern. We worked with Fern to help to provide important education materials. And so in their work, they distributed over 200 what we call sanitation kits. And these kits were, personal protective equipment and education about testing. Over a 5-week period, they distributed about 436 different flyers to help connect people to testing locations. And then they also held some webinars to really inform community members and address some of the concerns. For example, things like, will being tested affect my, status? Does this impact public charge? And really starting to answer some of those questions about engaging with governmental systems around testing. And then they also helped to actually facilitate testing connection through translation and actual navigation for 15 Latinx community members specifically through some of their efforts. Something else that we've done is really looking at our disability community and how are we engaging around planning for both testing and vaccine distribution. And so in December, we had an advisory group that was formed ad hoc that included a variety of groups. We're actually going to be reconvening that group very shortly to kind of learn from our initial vaccine clinics and how we're engaging with the community and making sure that the vaccine is accessible and that people in all communities have, again, the ability to have their questions and concerns addressed so that they're confident in the work that they're doing or the vaccine that they're going to be taking. So that being said, I'm going to pause. And again, I'm going to invite folks, if you have questions, to please feel free to put them in the chat box as we go. I'm going to actually turn the presentation over to my colleague, Tara Butler, who is with Howard County General Hospital. And she is going to share with us some of the outcomes from the work that they did. So
great, Kelly. Thanks so much. Are you going to be my driver?
Well, I can be because apparently it's not letting me give you the ball.
No worries.
I'm trying to give you the ball.
We are a team, and I'll just give you the cue. So good morning, everybody. My name is Tara Butler, and I am the Health Promotion Program Manager at Howard County General Hospital under the Population Health Department. I manage the Journey to Better Health program, which is Howard County's Faith Health Initiative, for those of you who are newly joining HCLHIC. So from the tail end of our meeting back in early October, we focused our community COVID-19 response discussions around access and, most importantly, trust building here in Howard County. We recognize vulnerable populations suffer disproportionately during this pandemic due to existing health disparities and limited access to health and community resources. So our primary objective in this collaborative community effort was to reduce barriers in order to reach everyone who should be tested and get them connected to the appropriate resources in a timely way. So studies have described the features of successful health promotion programs and partnerships in faith communities to include the importance of them as an ally to provide preventative health and social services to our at-risk populations. So partnerships with our faith community here in Howard County has helped to foster trust and create a positive space for our residents to access the care and services that they need. So we provided COVID-19 testing services at a variety of faith communities here in Howard County at no cost to the participant, and no physician order or insurance were required to kind of overcome some of those initial barriers. We typically had results back within 2 days of our clinic, 2 business days, and our clinical staff made phone calls to participants to manage conversations about what next steps look like and resources that they needed to stay safe and well, regardless of the results. So positive and negative, we were having really important conversations about how to access services or have a network around them while being isolated or quarantined. So during the later fall and winter months, we transitioned to HCC West Garage and the Howard County Fairgrounds to support a conducive and safe environment for staff and participants needing to access testing. Next slide. From our last report at the end of September, Journey conducted 10 more testing events to total 22 and tested 3,035 additional individuals between October and December, resulting in a total of 5,088 participants being tested between July and December. It was a huge undertaking and extremely rewarding as a public health professional. It was incredible to see what we could do in that short time frame. So next slide. Oh, thank you. In addition to creating more access to testing throughout Howard County, which was our goal, we also reached our at-risk populations. We engaged new faith partners that we hadn't in previous years and volunteers. It's incredible how many people just want to, help during these times, even if it's traffic flow or any of those pieces. They're willing to be a part of this and stay committed to helping the COVID-19 response in Howard County. Last slide. So we are extremely grateful for the partnership provided by the Howard County Health Department to support the success of this project, and truly believe that this initial work with our faith community partners will be critical in the efforts around vaccination, which Kelly had mentioned, for not just access to testing sites, but understanding the process and becoming more informed about their decision-making process, whether they're ready now or ready in a few months. We're going to be there to support them. So if you have any questions or are interested in Journey to Better Health and what we do at the hospital and in the community, please feel free to reach out to us.
Thank you so much, Tara. We really appreciate it. And, thank you all so much for the work and the partnership. I know that something that we have already had, and it actually, I think, is a credit to the great work that the hospital has done and the work that we've all been intentionally doing. We have actually had a number of organizations already reaching out and actually wanting to set up community vaccine clinics. And I think, I want to point people back to, what Antigone shared in terms of, some of our current limitations and what is in the state rollout process. I think it is particularly challenging, and I invite any of our panelists to sort of feel free to, add to this. I think it is challenging in that we do have community members who are ready to mobilize, but we don't have the ability to do that yet. And so what we don't want for folks to do is feel as if we're leaving them out to dry, or that we're not wanting to engage. And so I think referring and I think encouraging people to think back to some of the slides we talked about, things that they can do now would be incredibly helpful. I don't know, Elizabeth, if you want to add anything from the hospital perspective, or if there's anything that you want to add there. I don't want to put you on the spot with regard to that, but.
I think Tara did a great job going through what we were able to partner with the health department and the community on, from the summer into the fall. And obviously we want to be helpful in the community going forward. There is as part of HOCO RISE, there's a public health response work group that's getting ready to finalize its recommendations, and it's thinking about sort of the vaccine acceptance piece that you talked about earlier, and also what ground game we need to make sure that we can get shots into arms once people decide that they want them and we have the supply to put those shots into arms. So that will be coming out soon, but it's really going to take a coordinated effort to make this happen, and a lot of vaccine supply. So I think we've learned a lot from the past year, and building off of a strong base of community engagement, and it'll be good to move forward.
Thank you. Agreed. I think two words that keep coming to mind as I talk with people and think about, all that truly has happened over even the last year. I mean, it feels like an eternity, but it also feels like a minute in some degree. I think is reminding all of us about patience and grace. Patience in that things will open up, the supply will be increased, we will have more, and we will get people vaccinated. But also the grace to understand that I think many organizations, most of us, are truly trying to do the best we can with what we can and the limitations and challenges that we may be facing. So just continuing to have patience and grace with each other, both personally and professionally, I think right now is something that we can all strive for. I know that there have been a couple questions in the chat box, one specifically having to do with how are we working around trying to educate people about whether or not they qualify for the vaccine, and I think acknowledging the fact that there does tend to be, and there definitely has been, some known confusion about the different language. What I can say from the health department perspective, and I think certainly community partners can talk about from their perspective, is that vagueness has indeed been challenging for folks to understand. And I think that, there are many lessons learned with regard to communication and how we are sharing and conveying that. I think a big piece of it really is trying to engage with individuals and groups so that they understand sort of what this means for them. In terms of qualification and parameters, I think one of the challenges that has been we are facing is in terms of, verifying and documentation. For example, I've had teachers ask me, when I come for a vaccine, what do I have to show? How how do I show I'm a teacher? How do I show this? When we first opened up to medical providers, we really wanted to make sure that we were reaching our 1A providers in Howard County. And so, you know, having people be able to document for us, you know, that they were a provider in Howard County, you know, and communicating to them, like, what do you need to come with? I literally, when this first started, people would show up with their medical licenses that they had had framed and like come into the line carrying a framed license because they were like, I'm not leaving without my vaccine. So I think this is an example of continuous improvement all the way around. I think we're all learning much better to try to better communicate those. But unfortunately, I don't think there's there's not a one size fits all answer in that. I think it's again, working to educate our partners and calls like this and groups like this through HOCO Rise, through other partnerships to try to make sure that we are reaching that. I also see in the chat a lot of questions and information about how people can connect with the health department. So I know that the phone number and the email has been put in there. I'll just touch back on what was mentioned before. We are extraordinarily fortunate in Howard County that we've got partners from multiple agencies actually being able and being on with us to answer questions and connect with our partners. So we've been able to partner with our Office on Aging specifically, as well as our partners through Recreation and Parks and other agencies to actually be the voice at the end of the phone for our constituents who have questions and concerns. And we're also looking at working with and seeking increased partnerships with organizations like Neighbor Ride, organizations like faith communities who have, you know, their constituents and stakeholders that they're normally working with. We have lots of tools and resources that are available on the website. There's FAQs that we regularly update. I've been doing somewhat of a circuit of just sort of, you know, community education meetings with various boards and neighborhood associations. That's also something that we're happy to work with folks on. So again, I would just encourage you guys to keep the questions coming in the chat and we'll try to continue answering them as we go. But I do want to move into our next presenter. And so I wanted to turn this over to you. Laura, I'm going to try to give you the ball. It didn't work so well with Tara, but we'll make it work. I'm going to hand this over to you. It looks like it is allowing. Do you see that? You can share now. Do you see the box at the bottom?
I do see that.
Okay.
And
all right.
And I share.
Looks like you are going. So I'm very excited. It's extraordinarily refreshing to get to turn towards brighter days and exciting futures. And I think if nothing, well, there are many things COVID will have left us with, but I think in reality, one of the big things is now more than ever, learning about how we're going to address crisis in a coordinated way as a community could not be more timely. So I'm excited. Bless you. We'll see if there's a third one. Usually they come in threes. We're excited to have Laura Torres with us today, who's going to talk about the GBRICS partnership. So I'm going to turn it over to you.
Great, thanks. Yeah, so I'm Laura Torres, and I am the Behavioral Health Program Manager at Howard County General, also in the Population Health Department. And I am here to talk about a really exciting new program that Kelly introduced called the Greater Baltimore Region Integrated Crisis System, or as we like to call it, GBRICS, because it is a bit of a mouthful. So how did GBRICS come to be? It began with a RFP put out by the Health Services Cost Review Commission, or the HCLHIC. And the HCLHIC oversees all things hospitals. And so they put out this RFP saying that the hospitals can apply for it. But the caveat is that you can apply for it just as a hospital. You really have to include community partnerships and collaboration. The other things that you need to include are the Crisis Now model, which is a behavioral health model that is used in Arizona and Georgia very successfully. So it's a multi-million-dollar investment of an infrastructure across 5 years. It's $45 million, includes 17 hospitals, four local behavioral health authorities, and leaders in all areas, including our peers and consumers. So the regions that are included in this partnership are Baltimore City, Baltimore County, Carroll County, and us here at Howard County. So this is a list of the 17 hospitals, and you'll see that they represent all of the different areas we spoke about. And here we are, Howard County General Hospital. So what really is GBRICS? So let's start with the vision. And the vision of GBRICS is to establish a behavioral crisis care program across the regions that provides emergency response for anyone experiencing a behavioral health crisis, as well as suicide prevention. So I'm sure most of you know, and if you don't, we have a mobile crisis team here in Howard County called Grassroots, and they do a really great job. The challenge is that each county and area has a very different mobile crisis team, and so the services look a little bit different in all of the areas. And so what we would like to do with GBRICS is develop principles that include elements of Crisis Now, which would ensure that there's standardization around mobile crisis, taking a standardized approach, ensuring timely access to crisis services and support, and then using data so that we're able to really determine what is needed and how we can improve, and ensure that community partners are involved so that we're providing the services that best meet the needs of the community. And of course, we would like to create a return on investment that will reduce the cost of care for hospitals, as hospitals see many, many, many patients in our emergency rooms. And these patients are mental health or behavioral health patients, not just medical patients, obviously. So currently, here we have our general population, and this is how the workflow currently works in our current MCT system. So for the most part, people are very well trained to call 911 and do so for really anything, including behavioral health crises. What that means is that it then involves police, sometimes EMTs, and generally the destination where people land is here in our emergency department, where we then transfer them to either a mental health inpatient hospital or out into the community or a crisis bed service. And so there's very few calls going through our 24/7 MCT call line. And when I say very few, I don't mean that there aren't a lot. What I mean is the percentage of the calls, the vast percentage are here through 911. So with GBRICS, we would create 4 elements. One is a care traffic control system, which would be similar to air traffic control in that they would manage all the calls for the region and help direct whatever is needed, whether it be one of the mobile crisis teams or a connection to other resources. So we'd also like to expand the capacity and set regional standards so that all of the areas in the region have the same mobile crisis quality and quantity of services. We would like to expand same-day access. So when we have that large number of patients who don't need to go into an inpatient hospital, but do need support in the community, that we can get them to those treatment supports next day. And there's also a nonprofit multi-stakeholder oversight committee or council that is going to ensure that there is accountability for all activities that occur via GBRICS. So this is the new approach that will occur during, as GBRICS rolls out. We'll have much more of a focus here in these services and get patients to the appropriate destinations in that way. So just to kind of give you a little bit more information on each of the elements, the care traffic control will have a number of components. And one of the things would be knowing where there's beds available for inpatient services across the state, in real time, as well as where there are outpatient resources available. We will be able to identify where the mobile crisis teams are and ensure that they get deployed to the community members in need based on acuity as well as geography. And ensure that 24/7 care management is or services are available through this call service. So how will the care traffic control as well as our mobile crisis teams connect? Essentially, there'll be a regional hotline. So instead of calling the grassroots number or the BCRI number in Baltimore City, there'll be a regional number that will be called. And then the care traffic control will determine, again, where the service is needed. We currently in Howard County, for example, do not have 24-hour mobile crisis community service. We have a hotline, but we don't have teams that can go out 24 hours. So when we talk about doing things like creating standards, that would be one of the standards, is ensuring that each community has the number of crisis teams that they need and that they're functioning 24/7. And again, if we have a team here in Howard County, but it's Western Howard County and Carroll County has a need for a team, being able to deploy that team, if they are geographically closer to the community member than some of the other teams working in that area. And so expanding same-day access, part of the funding will be available for providers that work out in the community and need some assistance with training or technology or establishing a data process that maybe they don't currently have in their practice, so that we can ensure that they are ready and available to take community members into their organization to provide treatment within the same day. And ensuring that the consumers are and the community are engaged in this process. So again, we want to establish a strategy and develop a plan that is going to meet the needs of the community members. And so there are opportunities for community members, and I'll explain a little more before I end. One of the most important things that we really want to do is establish a cultural change. So because everyone uses 911 for every emergency, we want to really educate the community and ensure that they understand that 911 or bringing a family member or loved one to an emergency department is not the appropriate resource for someone who is having a behavioral health crisis, but that instead we have a regional hotline, and we really want to encourage people to really change the way that they view behavioral health crises, to not seeing it as something that needs to involve law enforcement or medical care, but that can be handled in the community for the most part. And so this is our timeline. So the RFP, our RFP was accepted in November of 2020, and the funding began last month in January of 2021. So for this first year, we're really focusing on planning and developing standards, really getting our plan developed for implementation across the 5 years. And then we will start doing some procurement in year 2, where we're looking at establishing a vendor for our mobile crisis teams. We're really hoping to get a vendor for the care traffic control this year. And, one of our focuses throughout the life of this project is really ensuring that we will be in a position for sustainability, because we want this program, we need this program to continue beyond the 5 years of the funding. And I apologize for my really hyper dog in the background. So what can you do to support GBRICS, or how can you get involved? Here is the email address for the GBRICS webpage. You can sign up to receive emails and updates on what's happening with the project. We do have monthly forums similar to these LHIC meetings that are open to the public, and the schedule is will be posted on the webpage. They will be recorded, so if you're unable to attend but would like to get the information. And we will be having some work group committees as we move through this process of building an implementation. And there will definitely be seats at the table for consumers and for community partners. So you can certainly express if you have an interest in participating in that manner. And lastly, I just really want to thank all of the folks who have helped with this process. So the preparation of the RFP took a little over a year, and we've all been working together, not just all of the different areas in the region, but definitely within our own county. So I want to thank the health department, specifically our LBHA, Rogers Bonacorsi, and our police department, as well as Horizon, who has not only helped in many areas with the development of this program, but also provided some funding to help us move forward with the planning. And our Howard County government representatives, Calvin Ball has been really supportive, as well as our Howard County NAMI. So thank you all very much. And
thank you so much, Laura. I appreciate it. I do invite folks, if anybody has any questions, you can feel free to put them in the chat box. I know that there's a lot of good information kind of being shared today. So feel free to, as the presentations and as our discussions go on, to share that. I do want to invite folks. I know that it's a long call and a long morning. We have about a half an hour left, and I intentionally wanted to make sure that we save time both for questions, but also to make sure that people have an opportunity to network and connect. So I'm not seeing any questions in the chat box, but when we open up the lines, I will definitely invite you, Laura, if you're able to stay on with us to add anything. Before we move, any further comments from any of our panelists, and then we'll kind of move into a quick stretch break for folks. Whoa. Having technical issues, my computer. I'm going on and off the camera. Sorry, everybody. All right. So I do want to encourage you, where you are, just to take a moment and, stand up and stretch if you need to, take a bio break or hop on and hop back off, and then back join us again. That's fine to do. Again, I encourage folks, lots of information being shared and questions being shared in the chat, so you can certainly continue to use that. I did want to do a couple quick announcements, and then we are going to open up the line for folks who would like to share some announcements from their organizational perspective. Something that's really important for all of us to keep in mind. We mentioned this when we convened this past fall, but I want to provide a bit of update. As you all know, we extended our current strategic plan through FY21. And so we are looking this spring to really develop our new plan that will provide us sort of navigation tools for their fiscal years 22 to 25. We may adjust and adapt to really be well in line with both the Health Department strategic planning processes, as well as Howard County General Hospital strategic planning processes. But we do really want to ensure that in the development of this plan, that we have participation by a wide range of our community partners. And so I use the analogy of not only inviting people to the table. People ask the question, and I've even asked the question of, who else should be at the table. But it's not just making sure that people are at the table with us, it's making sure that they're contributing to the meal as well. It's not just offering the chair, but it's also inviting the dish, inviting the perspective to what we do. And so I really want everyone to kind of think about this, and I invite you and encourage you to, put your name in our chat box, or your organization, or even, potential people that you think would be wonderful to include in this process, because we want to ensure that our plan is really focused on being responsive to our community, especially in light of what we've seen with COVID, that we're clarifying and refining what the role and what the scope and sort of even the structure of the LHIC is. Change is a good thing, but we want to make sure that it's planned and organized. We want to coordinate and amplify the efforts of all of our member organizations, not replace or do instead of, but how do we amplify our voices? Really focusing around communication, engagement, education, and access. But I want to encourage people to think about our LHIC from our role as we move forward in development of this new plan, kind of in 3 thematic areas, really looking at health equity and what role the LHIC plays in working towards health equity in our community, chronic disease prevention, and what role we play in chronic disease prevention. Again, thinking about how we amplify our voices and we amplify the efforts of our community partners, and thinking about what space the coalition has in that work, as well as wellness across the lifespan. And wellness across the lifespan, it includes, from preconception and maternal child health all the way through later in life, and what that looks like, everything from our physical and mental health included in there. So along those thematic areas, what we need to be focused on and what we should be focusing on within our strategic plan. So again, if you're interested and you are would like to participate, we invite you, certainly to share that. I know that many people had the opportunity to participate in the development of our last plan, and we'll certainly be reaching out to folks again around that. Another thing, and I'm actually going to just turn this over really quickly to my colleague Vanda Lardboon. We have just a quick announcement around some CARE App news for those of you that are CARE App organizations. So Vanda, do you want to kind of give us a little update with CARE App?
Sure, thanks, Kelly. So my name is Vanda. I am the program manager for CARE App, and we are pleased to announce that CARE App will be operated by Aunt Bertha. So it's a new vet software vendor, effective March 2021. So all this month we'll be going through the transition, rolling out trainings for our current CARE App partners the week of February 16th, and emails have already been sent out for that. Trainings will continue for our current users throughout February, probably through April, and then also a push to actually invite more organizations and partners to join this CARE App network. So more to come. Thank you, Kelly.
Thanks, Vanda. We're very excited about that, and I know that for those of you that have been participants with the CARE App program since its inception, I think this will be an exciting opportunity to see some of the feedback and things that you have requested and wanted really starting to come to a new fruition. So we're very excited about that, and definitely more to come. If you believe that you either want more information about CARE App, or you should have received some of the communications that Vanda had already mentioned, please feel free to let us know, and we'll make sure that we connect you with that. So I am going to open up the line here, but I did want to make a couple other quick announcements. We are pleased to be partnering with the Office on Aging and Independence, the Health Department, and through the LHIC, offering a series of Heart Health Months. So it's February and it's Heart Health Months, and I've actually seen a couple people posting some announcements in the chat around work that they're doing. Lynn mentioned some things that United Healthcare has going on. So Heart Health Month, we really know hypertension especially is correlated with poor outcomes around COVID, and some of those other chronic disease issues such as diabetes are also really impacted with some of our dietary and nutrition choices. And so we're excited to be offering a couple different programs. There was actually one yesterday, so I apologize. We didn't get it out to you in time. I think it's been shared. Hopefully everybody did see it, but we took it off of this slide. But please make sure that, you feel free to share those. We have them as events on our Facebook page. So if you have an organization and you'd like to share it as an event off your page, we invite you to do that. You can just, message us on our Facebook page and we'll also share that with you so that you can promote it that way. We also are very pleased that through the health department and the HCLHIC and a wonderful partnership with Aetna, we are offering 2 additional sessions. They are the remaining 2 sessions of a 5-part series that has been going on since this fall around behavioral health. And the 2 upcoming sessions next week, one will be around behavioral health trends with youth. And following that will be Growing Your Wellness Toolbox a month later. We've had some really exciting discussions. Last month's presentation really had, some very pointed conversation. I believe we'll be following up with additional sessions around the language that we're using and what people are experiencing in this time of heightened awareness and folks being open to discussing race and racial issues in ways that maybe the door hasn't been opened before. But these are important conversations that we need to be having. So we're excited to continue that partnership and look forward to that. And, certainly want to thank Aetna for all their work in that. I mentioned the vaccine telephone town hall. I'm just going to put that in there again. We do really encourage folks to participate in that. And I'm going to go ahead and in just a second here, open up the line so that folks can share any upcoming events that they have. I am going to ask that as we open up the line, people are, make sure that you go ahead and mute yourselves. I'm unmuting the line now, so we're gonna try to
15 minutes, then you got out early.
We'll ask folks to mute yourself. I can hear some that are not muted already. And if you have anything that you'd like to put in the chat box,
this is
ask you to please do that. Well, we'll try it that way. I want to ask folks if you have something that you'd like to share, I'm going to ask you to put that in the chat box. I do see a few folks I'm going to I'm going to call on here. So Sue, I'm going to unmute you, Sue Camardisi. I saw that you had mentioned a few things. Hold on.
Hello.
Oh. Okay, that's not working. Hold on.
How's that? No.
Yep, pretty bad echo there. Let's see. I'm gonna let me try someone else here, and we'll see if we can. Everybody loves technology, right? Let's see. I'm gonna open up. Hang on one second. Lynn from United Healthcare, I'm gonna try to unmute you here. Let's see if that works. Okay, Lynn, are you there?
Yes,
do you want to talk a little bit about some of the things that you posted?
Sure. So we're one of the proud sponsors for the Go Red for Women Day with the American Heart Association. It's open to the public. The event is on February 5th from 12 p.m. to noon. I mean, from noon to 1 p.m. I'm sorry. And the link is in the chat. We're also partnering with Mary Center to host a stress presentation on March 30th in coordination with the Prince George's Memorial Library. And that is called Café a las Cuatro, and that's going to be in Spanish, and that's available Anyone can register for that on the library's website, and that's on March the 30th. But the link for the American Heart Association event, which other people are partnering with them as well, but that is open to the public and free.
Wonderful. Thank you very much. I know Natalie Hall, who is one of our fantastic health educators with the Howard County Health Department. I know many of you have worked with her through Care App. Natalie, did you want to share some information about your upcoming webinar?
I did. Thank you. So in collaboration with the Health Department, the LHIC, and the Maryland Highway Safety Office, also known as MHSO, we've been working with on a webinar series, Be the Driver Who Saves Lives, and we have session 2 coming up Tuesday, February 23rd. That will be held from 11 to 12, and we'll be discussing teen driving safety. So right now, I'm sure everyone's aware that the Howard County Public School students are learning virtually, so they're not receiving the collision avoidance training that is required for students to park on school grounds. So this is something that we will be discussing. So I'd love to have you guys join, and then also if you could share the registration link with anyone, friends, family that you know that have teens that are driving, or soon will have a teen driver on the road. So that would be great. Thank you.
Thank you, Natalie. And yeah, unfortunately, we have experienced fatalities due to traffic issues and driver safety. So this is a really important work that we want to do. I know Sue also, she had added in the chat, but I just want to highlight here a very important reminder that in addition to being Heart Health Month, it is also Children's Dental Health Month. And especially in light of COVID, we know that many individuals and parents have, made some choices about their comfort level in even obtaining regular medical care. And we know that there are also many children who don't normally, under non-pandemic circumstances, receive the important dental care that they should be receiving. So we do invite you to visit the Maryland Office of Oral Health website. And I'll ask Sue to put that, oh, actually she already did put it in the chat box because there is a lot of information there. And so in what channels you have to encourage people to keep, folks getting that regular dental health care, oral health care is really important.
Kelly,
yes.
is there less now?
Oh,
yes.
Yep, there you are.
I turned off my phone. I wasn't using it, but it's still, I guess, reverberating. As far as what's on the website, there's also a resource guide there for anybody who may be seeking care that may not have insurance or has Medicaid, which is also very useful because we know there's a correlation between heart disease and oral health. So I'm sharing that as well on the website. And also I want to highlight that we've been sharing supplies with WIC and also Head Start groups. Even though they're not meeting in person, they do need resources such as toothbrushes, toothpaste, and other resources.
Wonderful.
Health Department, the Maryland State Oral Health Department.
Thank you. Thank you. I noticed in the chat, Cinda Chase is on, and I have unmuted her. Cinda, did you want to just share what you had put in the chat for everybody?
Yeah, so a lot of you may already know, it's kind of been in the works for a while, but we were actually purchased by Care First of Maryland. So as of February 1st, our name did officially change to Care First Blue Cross and Blue Shield Community Care of Maryland. So we just wanted to kind of let, especially providers know. I know they did mailings to members this past month, and of course, everyone's been advised as far as providers and members through like emails, texting, blast fax for provider offices, phone calls. So we definitely have done a lot of informing over the past couple of months. We actually, became employees of Care First in October. So it's been a busy couple of months, to say the least.
Sounds like it. It sounds like it.
Yeah.
Well, thank you. Thank you. I'm going to also ask, I'm going to unmute you, Kirsten Miner, who is with the health department, to talk a little bit about vaping. Give me 1 second, Kirsten. You should be unmuted now, Kirsten.
All right, can you guys hear me? All right, so as Kelly mentioned, my name is Kirsten Miner. I'm one of the community health educators within the Bureau of Population Health at the Health Department, and I am responsible for our vaping education. We had a program called Tobacco Awareness Program for Teens. However, due to COVID, we have been tailoring program to accommodate all individuals. So essentially, if you are a parent or an adult figure who is interested in learning more about vaping and its impact, aside from youth brain development, but also increased risk for COVID-19 and mental health, because we also know that a lot of COVID-19 has caused a lot of stress, and some individuals are coping with stress through substance use, but that's also inclusive of vaping and tobacco or marijuana products. So if anyone's interested in receiving information around vaping education, you can, of course, contact me at kminer@howardcountymd.gov. I'll put that in the chat. But we can also redirect you to our hdhealth.org. We have a community virtual education form that can be completed. And there's a checkbox actually for vaping education.
Thank you, Kirsten. Clara Richards with Howard County General Hospital's Journey to Better Health team. Clara, did you want to talk a little bit about the programs that you have coming up?
Hi, Kelly. Sure. Hi, everyone. I just wanted to remind everyone that we still have all of our Living Well classes moving forward, and we've even pre-scheduled for the spring a lot of our classes, so there's plenty of time for people to register and get the word out about the classes. So if you have people that are interested, if you were like the general flyer, I can send that to you, Kelly, that has the link to register for any of these classes. You can, Kelly, I'm sure will send that out, and I can send that to you if you email me directly. But we have so many classes coming up: the Living Well with Chronic Disease virtual, as well as the phone-based classes, Living Well with Diabetes Toolkit, which is phone-based, and the Tomando Control de su Salud, las herramientas, which is like the toolkit for Spanish language, and that one will be the first time that we're running that version of the class. So it is really exciting, and we're ready to accept registrations if you have anyone interested.
That's wonderful. Yes, thank you. Definitely. Please share that with us, and we'll make sure that we get that out. I also noticed in the chat there's a couple of other programs. Michelle Holder, did you want to talk a little bit about the programs that you have coming up?
Hi, everyone. My name is Michelle, and I'm from Food Center, and we're located here in Howard County. And this coming Sunday, February 7th, we'll be having a virtual cooking course. It will be with me and my mom. My mom has suffered with, or I wouldn't say suffered, fought against issues like prediabetes and hypertension. And we're from the Caribbean. And I'm a sociologist and anthropologist. So I bring in concerns that relates to cultural relevance around food and health education, bringing in mindfulness as one component to what we do. And so it's going to be a live cooking course. Once you sign up, I sent the link, you'll get a registration, a list of the grocery list and prep list. And so we are doing work to bring awareness around food, intergenerational behavioral change, and awareness that is inclusive of the African diaspora. So
Thank you, Michelle.
February 7th, 2 p.m. Sunday, 1.5
Wonderful.
hours.
And I know you put the information in the chat box. So, and again, we'll make sure we send that out to everybody shortly, because I know there's a lot of exciting things coming up. In just a second, I'm going to open the line for Karen Bassinger to talk about a program that they have coming up. But I know that Kelly McMillan with Howard Community College also entered in the chat that if folks are interested in public health interns for this spring, and I think that, you know, again, thinking about as individual organizations, how each of us can be working to increase that educational efforts that we have in engaging our vulnerable communities, I would definitely reach out. I can personally attest. I've supervised interns from multiple large institutions as well as our Howard County, our local community college, and truly some of the finest interns I've had have actually been from Howard Community College. And so it's always been a pleasure to work with them. So I'm going to ask Karen Bessinger, do you want to talk about your program?
Sure. University of Maryland is part of the National Extension Educators Network. And this is a joint project we've done, which is called Dining with Diabetes. It's a 4-part class. And generally, we do some we incorporate cooking in it, but because it's virtual, some of our lessons are video oriented. But it's about how to cope with the different parts of diabetes, but also incorporating nutrition and how to make sure you keep your numbers where they are. And it is a 4-part series. The next class is February 22nd. It's through the 50 Plus virtual learning platform. And I'm going to be talking to the library to see if they want to open it up and we can run it that way as well. But it is a great program and it brings everything down from complicated down to simple. So that's why we do it as 4 parts, to take individual components of the diet and diabetes to make it real for you. So, and it is a free course through the 50 Plus Center, which makes it even more exciting.
Thank you so much. It is an exciting, exciting course. I know Erin Ashenkhurst with ARI, Accessible Resources for Independence, she had to hop off, but she did share that they have a Zoom fitness class. And it's really intended for ages 16 plus, but it's a really interesting, exciting program. And she provided a lot of information about a group that they have through the Spirit Club. I think I just also want to give a shout out to ARI and our partners with Howard County Autism Society, as well as ARC of Maryland, have been really wonderful in working with us as we've kind of talked about working with individuals both with cognitive as well as physical disability, and making sure that we are being or working towards making sure that we are inclusive of everyone in our COVID response and all of our public health initiatives. So big shout out to that group of individuals for the work that they've been doing. I know that there's a lot of other probably information that folks have. And again, just because I know that it got a little crazy when I tried to open up the line, I would like to go ahead and just in recognition and honoring everyone's time, what I'm going to do is I'm going to formally conclude our meeting for this morning, but I am going to remain with the line open for the remaining few minutes. We will be, and we'll send it out again in the minutes. We included it in the agenda. We're confirming meeting dates for this upcoming fiscal year. And we will also be reaching out to folks around the strategic planning process. So we certainly ask you to keep connected with that. I want to thank all of our panelists today. I know a few folks had to hop off, but I especially want to thank my partners, Tara Butler and Laura Torres with Howard County General Hospital. And it truly is a partnership. And before we close it all, I don't know, I think Dr. Kalm, you're the representative of our executive team and our co-chairing organizations this morning. If you had any final words before we officially conclude that you'd like to share.
Thank you, Kelly, for putting together such a great meeting, and to all the presenters. And I just want to underscore the GBRICS work that Laura talked about. That was a huge lift, and it really does have the potential to be transformative when you think about how we address behavioral health. And I just love that it's involving multiple counties and multiple hospitals and health systems. And it's really a testament to the power of collaboration. So I can't wait to see it move forward. It's going to have a big impact for us and for the state. And I think it's great that you're leaving the line open for a bit more of connection. We all need that. So thank you.
You're welcome. And I am going to, as I said, I'm going to invite folks, if you'd like to stay on, I am going to open the line. So that is when the children coming up in between breaks, as mine are about to do, and somehow needing nourishment from the kitchen, the animals barking, the spouses who have been hiding in their office spaces going, can I peek out now? Whatever is about to happen in the background, everyone just, again, remember, as I said before, throughout this time, both personally and professionally, I invite all of us to do what we can to continue practicing patience and grace throughout this process. And I look forward to seeing you all again in person. But as I said, we'll keep this line open for a little bit longer. And hopefully we'll see all of us again very soon. Remember, stay safe, keep washing those hands, keep wearing your masks, keep maintaining distance, even once you're vaccinated, keep doing those things so that the sooner we are better under control with all of this, the sooner we'll be back in person seeing each other's faces. So take care, everybody.